What are the radiation risks of a bladder cystogram? Imagine getting a detailed picture of your bladder without surgery. That's what a bladder cystogram offers. It's a common test used to check the shape and function of your bladder, especially if doctors suspect issues like bladder cancer or other problems. During the test, a contrast dye is inserted into your bladder through a small tube, and X-ray images are taken to see how your bladder looks and works. Now, you might wonder about the safety of using X-ray radiation for this purpose. Ionizing radiation, which is used in X-ray imaging, is a form of energy that can pass through tissues and create images of your internal organs. While radiation is crucial for accurate diagnosis, it does carry some potential risks. The main concern is that exposure to ionizing radiation can cause cellular damage, which over time might increase the chance of developing cancer. However, it's important to understand that the amount of radiation used in a bladder cystogram is very low. Compared to other imaging tests like computed tomography scans, which deliver higher doses of radiation, a cystogram's exposure is minimal. The typical dose from a single cystogram is considered safe for most people. The benefit of diagnosing or ruling out serious bladder conditions usually outweighs the tiny risk posed by this small amount of radiation. Radiation risks are generally categorized into two types. Deterministic effects, such as skin burns, only happen at very high doses, for above what a cystogram involves. These are not a concern here. The other type is stochastic effects, which include the small possibility of increased cancer risk. For a single cystogram, this risk is extremely low and difficult to measure in an individual. The risk may slightly increase if multiple procedures are done over time or if cumulative exposure builds up, but for most patients, having an occasional cystogram is considered safe. When it comes to bladder health and cancer detection, the diagnostic value of a cystogram is significant. Early detection of issues like bladder tumors can lead to better treatment outcomes. If you're worried about radiation, talk openly with your healthcare provider. They can explain why the test is recommended and how it fits into your overall health plan. It's also good to remember that besides radiation, there are very small risks related to the procedure itself. These include a slight chance of urinary tract infection from catheter insertion or rare allergic reactions to the contrast dye. Usually, any discomfort experienced during or after the test is mild and temporary. Medical authorities agree that the benefits of necessary diagnostic imaging generally outweigh the small risks from radiation exposure. When a cystogram is needed to investigate symptoms like blood in the urine or recurrent infections, it is a safe and valuable tool. If you have concerns about radiation, your doctor can provide personalized advice based on your medical history. Always follow their guidance and report any symptoms after the procedure, such as pain or fever. In summary, the radiation risk from a bladder cystogram is very low. The small amount of radiation used is unlikely to cause harm, especially when balanced against the important information gained about your bladder health. This test is considered safe and helpful in diagnosing conditions like bladder cancer, helping you and your healthcare team make informed decisions. Remember, always discuss any worries with your doctor. They are your best resource for understanding your individual risks and benefits.